Morning, Laurent. Thank you for joining me here on this interview for Medics for Clean Air. How are you?
Fine, and good morning to you also.
Thank you. Thank you. So, Laurent, I just wanted to start with a bit of an introduction to yourself and a bit of your background and a bit of why we're talking today.
Okay, so my name is Laurent Chambaud. I'm French, and I was a former director of the School of Public Health, EHESP School of Public Health in France. I'm a medical doctor by training in public health, and now I'm senior leader for ASFRE on climate change and health.
Great, and thank you for that. And ASPR is the Association of Schools for Public Health in the European region.
Yes,
Yep,
yes, exactly.
great.
It's quite important because it's not only at the European level, EU level, but it's broader than that, and it's more like the WHO region of Europe.
Yeah, absolutely, absolutely. So it's really great to have you here today. I know you have a lot of experience and a lot of initiatives to work with kind of education and sustainability and climate and environmental health within schools of public health, and obviously, these people who go on to then work in the healthcare sector. So I just wanted to start today by saying, as we have climate change happening, where do you see the role of healthcare workers in students in facing the challenges of climate change and in advocacy and mitigation and adaptation?
Firstly, perhaps I have to say that healthcare workers and students are firstly citizens. So as citizens, they have also to participate to the global awareness on the climate change. But I think that there is also a specific role for healthcare professionals and also healthcare managers, because I think they have a really good position, firstly, to document the impact of climate change on health, and that means not only the direct impact but also the indirect impacts and all the global impact of climate change on health. So I think it's one of their role. The second role I can anticipate is really to explain and inform about the burden of diseases. That means not only perhaps the climate burden or what is the consequences of the climate change, but perhaps more broadly the environmental burden of diseases. And climate change is part of that, but we will have also to look, I think, more widely on the environmental burden of diseases. So I think it's also one of the role of healthcare workers. And the third one is more advocacy, because I think that the healthcare workers are really an important voice for decision makers at each level, but perhaps more than others at the local level. So I think that they can do something to advocate at the local level.
Yeah, absolutely. I couldn't agree more there, and I think there's such a strong need for local level action in the greater collaborative kind of action against climate change. So when we're thinking about this and local level changes and that sort of thing, what does the health system need to do, and what do healthcare staff and students need to do to be best equipped to face these challenges that we'll be seeing in the
I think that there are a lot of things that the healthcare workers will face. So mainly, perhaps the first things that I would like to say is that we have to develop research and we have to develop training on this topic, because we don't know everything. And so we have to better know what are the direct and indirect impacts on the healthcare system, and also So we have to document as much as possible because we have to base our advocacy on knowledge. And also we have to train as much as possible all the future healthcare workers and the population. And for this, I think it's really important to have a link between health and public health on that, because that means that perhaps people in public health can help to develop specific trainings on this. The second thing I would like also to say is that we see in different countries some analysis about what is the impact of the healthcare system on the global carbon footprint. So, for instance, we have some studies in UK, we have some studies in US, we have some studies in France and perhaps in other countries. But I'm not sure that the framework is the same, that the methodology is the same. So I would love to see some comparative analysis on that, and also to secure that what we will say will be the reflect of the reality on what is exactly the contribution of the healthcare system on the total carbon footprint. And the third thing I would like to insist on is the healthcare system will be in a very difficult position in the next years, because in one hand, as I said, we have to limit the contribution of the healthcare system on the total carbon footprint. Okay, but in the other hand, the healthcare system will have to face the increase of the needs, health needs, and it will not be only the effect of the climate change. It will be the effect of the epidemiologic transition, the increase of chronic diseases. It will be the effect of aging, and for this, they will have to, in one hand, try to limit the contribution of the healthcare system on the effect on climate change, and on the other hand, it will be like a paradoxical situation in which they will have to face this increase of the needs. So for that, I think that we will have to really monitor what will happen. And let me give you an example. You have more and more people with severe renal failure. And these people need dialysis. For dialysis, we need a lot of water. So if the hospital decided to limit the water in the hospitals without any information or without any cooperation with people who face this disease, it will be a disaster. Even with degrading the quality of their care. So this is to illustrate that we have to really be careful. We have to go we have to be very prudent in our way to do, but we have to develop the global awareness and to try to have the safer healthcare system as possible, but also to have a healthcare system who will be contributing to the fight against the climate change. So very difficult situation, but this is also something that we have to do anyway.
Yeah, absolutely. I couldn't agree more. It is an incredibly difficult situation, and I've heard people like Maria Neira at the World Health Organization say that, you know, the healthcare system is paying the price for fossil fuel extraction, for example. So it's a really good point you raised there about how the impact on the health system and that kind of interplay there. So thank you for highlighting that. So just, you know, Yep, sorry.
Sorry, Kel. Just also to add something is about the international cooperation, not only at the European level, because for that we know also that, for instance, we estimate that the contribution of the healthcare system in the US is around 10% of the global carbon footprint. It's said that it's 8% in France, 4 or 5% in US, but it's 2% in India. And so we have to develop this international cooperation in order to develop the quality of the system anyway, but also to try to limit as much as possible the carbon footprint. And that means also that we have to transform the healthcare system, which cannot be based only on developing the hospitals.
Absolutely, absolutely, very true. And we can't just say it's just the hospitals. It needs to be the whole system. I know that a lot of the carbon footprint of the health system is in the scope 3, so transport and supply. So
exactly.
It really is, it's not just about that kind of hospital-based energy use. It's about wider things. So you've said that healthcare workers and students should be advocate citizens. So I'm just wondering how can healthcare workers and students integrate kind of public health into conversations about sustainability?
I think that if for that, it's absolutely necessary to set up a common basic training program for all health workers. So I think it's we will not face that if we don't transform the training of all the healthcare workers to increase their degree of awareness on that. So so this is perhaps the first point. The second point for me, and I just said that before, I think that we have to strengthen the ties between health and public health. And that means that we will have perhaps the possibility with that to develop a common understanding of not only at the individual level, but also at the collective level. So I think it's also something that I pledged for that for years and years, but I think it's really important. And perhaps the third one, I think, is really that if you speak about sustainable development, you speak in one way on One Health. And I think really that it's important to enlarge our vision and to have this One Health approach, not only like a theoretical notion, but really in our professional practices. And it's really something in which we need some case studies. We need to exactly know how it will work, this One Health concept. So perhaps it's the 3 ways I see how we can contribute to that.
Perfect. Yeah, those are such good points. I think we need to have this kind of mindset of the interconnectedness of not only our systems and our collaborations, but One Health, animal health, environmental health. And I know that's something that the World Health Organization and the United Nations are pushing for in recent declarations. So I think we have momentum building towards that, but it's great to hear that we should integrate that on kind of the teaching and the advocacy and the local level as well. Perfect. I really appreciate you making the time today, Laurent. So thank you for talking to us, and let's do it.
And thank you for inviting me.
Great. Thanks, Laurent. All the best.
Bye-bye.
Bye.